evaluation of programs, implementation of CSR programs, and many more. And these are some of the accreditations and the certifications of the CHD group. So moving further, as I mentioned, that Edward and Cynthia Institute of Public Health, it is a unit of CHD group, and it is an advanced technical cooperation center with the Yenagoya University, and we are also a member of Global Consortium of Climate and Health Education. Currently we are having an admission process going on for Masters of Public Health offered by Yenagoya University in association with Edward and Cynthia Institute of Public Health. So now I have like mentioned that we are having an admission process going on for Masters of Public Health, but what is this course? So if I go by definition, so according to WHO, it is a science and art of preventing disease, prolonging life, and promoting health through the organized effort and informed choices of society, organizations, public and private organizations, community, and individuals. So overall, it is mobilizing and engaging local, state, national, and international resources to assure the conditions in which people can be healthy. So now this is what the technicality of public health, or we can say the definition of public health. But being a public health professional myself, I would like to say that for me, public health is really an interesting field. It is very interesting field. If you get a chance, you can just go through the syllabus of public health, and because this is how I was exposed to public health. I have don't have my bachelor's in public health. I am from microbiology background, but I wanted to pursue something which is interdisciplinary in nature, and that is how I was exposed to public health. And now I am here working like after my internship at Niti Aayog and fellowship at Ladley Foundation Trust. Currently, I am working with CHD group, and I can say that this experience in working in public health is really was very much a learning experience, a very good learning experience. The sad part is that students from bachelors, majority of them are not aware that about the public health course, what a lot of opportunities are waiting for them if they join this course. And because as I mentioned that when I was in my bachelor's, I was also not aware about this field, but then because of my interest in something else, I was exposed to this field. And this is what is our vision, that we want to create people, or we want to ensure that young minds are a part of this field, because India, or we can say at a global level, we need people who are very much skilled, who can use their skills, their expertise in the public health field to, which will help us to attain or achieve the sustainable development goal as well. Why it is very much interesting for me, first is after pandemic, this field has gained a lot of popularity, and people actually have realized that the importance of this field. And the thing is that this field is not only limited to one aspect, it covers a lot of aspects, whether it's a social aspect, it's a medical aspect, or we can say economical aspect. And the best part is it is an interdisciplinary field. So I already mentioned that why I chose this field, because I wanted to be a part of an interdisciplinary sector. So it covers epidemiology, it covers national health programs. So if, I know like most of you must be aware about maternal and child health programs, then program for adolescent health. So these are all part of public health. If somebody is from different background, and it is not limited that the people who have done their bachelor's in medical or who are from medical background only can apply for this course. No, this field, the best part of this field is that people from diverse background can use their expertise, gain a master's degree in public health, and then can apply for different job opportunities. If somebody is interested in economics, they can go for health economics. Now somebody believes that they have a good management skills, they have good coordination skills, they can go for project coordinator, they can go for jobs like project management. Then if somebody is really interested in dealing with data and analysis, then the biostatistic field of public health is really good field for them. Then currently in today's world, I can say that policy making in public health is gaining a lot of attention. Then if somebody is interested in climate change, environmental health, then if a student is really interested, or it is like the person is really interested in working in the field, want to interact with the community and know their problems, what are their factors, what are the reasons that affect their health. So public health is the field for them. You can, like, as I'm interested in social determinants of health, so people who are interested in knowing what are the social factors which can actually impact the health. So like this, it is an interdisciplinary field where you can use your expertise, your interest, and your background, and you can actually implement this all your expertise, and can like we can get a good future health workforce. So, moving further, for scope of public health, it is not only limited to this certain points. We have a lot of more opportunities in public health for surveillance, monitoring, health promotion. Now we know that people lack awareness on public health, or people lack awareness in general about the health aspects. Like, if I may ask, like, how many of us we go for a regular health checkups? Being a public health professional, I don't go for my regular health checkups. So what we can expect from people in the community who are not aware that what is the importance, especially now we are having a breastfeeding week, right? People from various backgrounds, they are not aware that how important it is to have an exclusive breastfeeding. The importance of exclusive breastfeeding for mother, for child. Then no so this is a part of public health where we have to raise awareness about different public health issues. then um, then health promotion, as I mentioned, like here do boon zindagi ke, so these are the IC promotional things which we go under, which we have under public health to make people aware about different policies, different their medical rights, and why public health, or health in general, is important for them. What are the health policies are available, which under which they can have different benefits. Then moving further, so these are some of the IEC materials which Government of India has mentioned for raising awareness for the public, for people. Now, as we can see here, that it is not limited to one particular field. The food and like different sectors are involved in public health. For example, food and nutritional sector. Different government bodies like Women and Child, like Ministry of Women and Child, okay, Ministry of Health and Family Welfare, education sector. So for our course details, we aim to create the health professionals who will contribute to improve the public's ability to live healthy and safe life. And this is a 2-year program, and it is an extensive program where we engage students in different field work, different paper writings, their publications. And recently I would like to inform, like, I would we have published our first working paper on firecrackers with the students have also contributed in this paper. Then recently we had in the last month we have a climate change workshop also. Then we have a webinar on breastfeeding as well. Then so what are the eligibility for MPH? So any graduate student from UGC approved university in India can apply for this course. Bachelor's in medicine, dental, nursing, pharmacy, Ayush, allied health sciences, arts, commerce, law, engineering, management, journalism, sociology, biostat, psychology, nutrition studies. So like this, we don't have any limitation on which background the student belongs to. Then only the student should have 50% aggregate of marks if they belong to general category, and 45% if they belong to SC, ST, or OBC category. So this is the fee structure that we have for the Indian student. For first year, we have 1,82,500, and for the second year, we have 1,07,500. So now, why students should enroll for public health course at our field? at our organization. So as I mentioned, that students have been a part of different publications, so they are equipped with different skills, and gaining a master's degree will actually improve their skill set, will give them the knowledge that they require in public health. So basically it will form their foundation. And to all the students also, I always say that, after your public health masters of public health, they should give their 4 to 5 years at least to just explore the field, because this field has to offer a lot. At Edward and Cynthia Institute of Public Health with Unipaya University, we give them exposure to different aspects of public health. Recently, they have visited to old age home to understand the health aspects of the geriatric population. Then they visited to the air traffic control to understand the occupational health. So this is how we connect different aspects to the public health and give exposure to our students to understand what the practicality of public health. We give them direct hand-on training, field visit to strategic location of importance, interaction and association with world-renowned leaders, skill development, like they understand research, how to write research papers, how to improve their writing skills, analytical skills. They have to develop their software skills. So at our organization, we help them develop the different software skills to analyze the data, to understand the data, proposal writings. And we have different internship opportunities with leading public health agencies and organizations. So if a student is a part of Edward and Cynthia Institute of Public Health with Unipaya University, they will have industrial recognition, 100% placement assistance, published papers, writing chapters in book, worldwide networking. This worldwide networking also because the organization has different collaborations. Then we used to conduct different workshops, webinars, and so they will have notability in the public health sector. We have different section in our website for which is only dedicated to the students' work. Our many students have published their blogs on different topic of their interest. So job opportunities are not limited in public health. You have different opportunities in government organization. They have opportunities in academia, in non-government organization, like in government organizations like Ministry of Health and Family Welfare, research institutions, medical colleges, rural development, institutes of public health, private foundations, United Nations, corporate companies. They can be a part of any CSR projects, consulting firms. So what are the job roles which the student can get after completing the Masters of Public Health? So they can be research associate, they can be lecturer, they can be research officer, then biostatistician if they are really into data, health policy analyst, consultant, health educator, health communicator, health. They can go for health journalism if they are very much interested in writing about a particular topic, communicating it through different art forms. Field officer, then public health project coordinator, public health manager. And these are some pictures from where our students went for their field visit. So this is one of the pictures of, okay, 1 minute. Okay, this is one of the picture where they visited for at old age home. They interacted with the elderly people there. Understand they have got an in-depth knowledge of what these people go through, what are their experiences, what is their health status, and how how they're living in an old age home, and what old age home has to take care when they are getting these population. Then they went to ATC also to understand the occupational health. So we are having a Masters of Public Health course, and also we are we will have sponsorships or scholarships also for the students. So these are the details where if a student is interested, they can visit the ECIPH website, and these are the contact details. Thank you.
Very nice. Yeah.
Thank you.
Thanks,
Thank
Isha.
you. Yeah, yeah. So any questions, anyone?
No, I think more or less, no, everything is very clear.
She's, yeah,
Uh,
yeah, yeah.
so you can probably have in our website, um, if, some space for
Hmm.
employment or no, studies, etc. And we can add PPT or a PDF there and
Mm-hmm.
give contact point. So whoever is visiting can take it.
Yeah,
Yeah.
that's a good. Yeah, we do have a space for advertisement. You can share me the PPT if it is okay, Isha. We will post it on our, yeah. Yes, Subir, please go ahead.
So first of all, thank you very much, Isha, for this really enlightening information to
Thank
give
you so
a
much,
good
sir.
perspective about public health. And typically, I also believe that to be in field of public health, you need to be somewhere related to medical sciences or biological sciences. But thanks for helping me look beyond the obvious. Okay, so there is so much of possibilities. I think this is a very great area of making careers, possibly less competitive because people. I mean, great opportunities, but many very few people actually look at it this way. Only when people have this information, they can make most of use of it. Use of it. Otherwise, people rush for the regular career. So this is good. One question I had is that okay, I got the
Yes, sir.
point that you have a fee of 1.82 and then 1.07 for second year. Okay. One, see, we were looking for this sponsorship for one international student, possibly one national student for sure. And we will certainly work towards it. We can make it happen. Only that the time is short, so we have to find a right, deserving candidate so that we can support that person. Okay. Possibly, we as a club will also look at if the institution, because we are sponsoring a candidate, we may require some help that if the fee payment is made a little staggered, okay, like if you allow our club to give in installments, okay, because we have about 1 month, 1.5 month, whatever period. When it starts, 1st of September, I don't know. So we have 1 month.
Yes,
We are
September,
a
sir.
yeah.
small club. Yeah. So we may, I hope that we shouldn't require, but in case we require, maybe we will request that, okay, let us support a
Okay,
student
sir.
in installments. That is one. Second is, see, this is the school fee or the education fee. On top
Hmm.
of it, there is this hostel fee, I suppose,
Yes, sir.
right? So that nowhere appears. So if you can also tell
Mhm.
that in case of a boy or a girl, what will be the regular monthly hostel fee, so that we when we are sponsoring a student, we also consider that what support that person will need from the hostel expenses. Otherwise, we will just look at it that it's only 3 lakhs for 2 years. We won't even consider the hostel part. So that is one thing I thought of asking you. Okay.
Sure, sir. I will ask sir and will let you know all the
Yeah.
informations
Like
regarding
what
the
will be likely
scholarships and
hostel
all.
fees? Yeah.
Yeah,
Any
sure,
other
sir.
expenses? Yeah,
Hmm.
that will be the
Okay.
So I had a discussion with Dr. Edmund. So what he's saying is usually we should let the students take care of the hostel fee. What they are seeking is basically the fee, the educational fee. If you get the support for that.
So, Gitanjali, I hear you. The point is that, if we get a student, deserving student from a very far off, economically difficult situation student, for
Hmm.
them, let us say the, Poya Mangalore is a costly city. And,
Mm.
if the hostel fee is some, let us say 7, 8 to 10,000 rupees, that is not a small amount for a person coming from very rural background or in a very academically challenged place. So it's not that, we should not consider that. Okay. And other
Hmm.
question I had is that it will be helpful if you can help us know if there is any arrangement that you have with the bank, that banks can provide student loans and we can act as a guarantor or partial guarantor or something. But if any such schemes are there for because it is in the realm of the CSR of the hospital of the banks also. See, banks
Okay, sir.
funding
Hmm.
public health is something in line with the CSR initiatives, right? So they should support
Sure,
more
sir.
of the public health. So if you can tell us that is there a program that we can possibly be co-guarantor for it. Student takes the loan, and we become
Hmm.
the co-guarantor for it. You know,
Okay.
Mm.
Okay,
These
sure,
things
sir.
I had this question.
Sure, sir. I
Yeah.
will discuss these points with sir and will let you know.
Yeah, Subir, I also had a discussion with one of the co-presidents. If you remember, I was mentioning he himself is a banker. So, what one good suggestion, like if CHD is, also looking at, if we can do this, give this part scholarship, take care of the part scholarship, is
Hmm.
what suggestion was that as a clerk, you deposit an X amount, like say 1 lakh, and from like if we 10 clubs come together and we say that like 1 lakh is deposited in his bank, so the interest can take care of the fee. I mean, this is what one option
See,
he.
Gitanjali, good good point. One, I agree with on the scholarship part. Like if the college itself has got some scholarship, and
Mm,
if we can couple it with our Rotary support, and
mm,
let's say the scholarship pays for 50%, we pay for 50%, then it lightens the load. But
mm,
interest wise, if you see, I mean, as it is in India now, the interest rates are say 6%, 7%. Okay. So if you think that you will generate 1 lakh to pay for a student's year, that means you will have to deposit 13 lakhs to get 1 lakh. Okay.
that's true.
So I
Mm,
think it's I mean, that's my thought that, since
mm,
it's not something like you are looking at a retired person's life, you are looking at some, in the short run, if you want to fund for one student for 1 lakh, you have to deposit 13 lakhs.
mm.
Okay. So,
True, true, true. So, and Isha, just to update you, we are in also touch with one of the Rotary clubs in Gambia, and they are also in touch with. They have something called Leadership Institute there. Okay, and they are trying to because as a club we are very particular that only needy person should be onboarded for this project, because people who can afford, and there's no point supporting those students, be it Indian or Gambian. So I have also mentioned that she wanted to know, like um, uh, uh, whether air ticket and visa and all. I said no, that is not our this thing. Probably we can request that club to take care of that. So they are they are looking for a student on a high priority. So let's see, in another maybe 10-15 days we should get yeah, Subir, you wanted to ask something?
so I was trying to say that our bigger, I won't say problem, but the bigger question is, where is the student whom we would like to, where is the deserving student, a
Yeah,
deserving candidate whom we would like to support?
yeah, yeah. So this is
So,
that's what I said, because in Gambia we don't know. That's why we are tying up with Rotary Club of Banjul.
hmm.
Okay,
So
so
if
remember,
if
yeah.
Banjul gives, let us say we can agree with Banjul, either we give a full sponsorship or we give half sponsorship. Okay, that we can
Mm,
do. Other, but then given that the issues about visa and all the travel formalities, if you book a flight ticket in a short run, that itself will be very high. So many things are there.
mm. So maybe
I would
we
like
can
to hear. Hmm.
talk to the High Commissioner also, because he is also part of this whole MOU that has been done, right? So and I think if I'm not wrong, they have a, tie up with the health department of Gambia also. Probably, like some ministerial, or I think these are the small things which can be worked out, I'm sure.
Okay. But
Yeah.
otherwise, I think within India, like if you, how can we find any deserving candidate who are very keen on this subject, who will be serious? I'm not saying that who has to be academically very, very brilliant, but merit lies
Mm.
in possibly the perseverance to do something of this nature, right?
I
True,
think
true.
That's
that's
I
the
believe.
question. That's the question I
Yeah.
had for Aisha is how do
Mm.
you identify those who are really motivated to actually towards public health rather than any typical, course they're trying to. So what's the your mechanism to sort of identify? Say you must be having more demand than what you can. accommodate. That's what my assumption is. So, what's your mechanism to filter people not academically excelled, as Subir was saying, but who are truly motivated towards public health, isn't it?
Okay. So,
Yeah,
sir,
public health is yeah.
sorry, you were saying something.
No, public health is something not like any other profession. That is, it really needs some sort of a commitment and perseverance, as Subir was saying. So how do you really identify those candidates?
So, sir, right now we are having like for especially for the scholarships also, we are having one like students have to send their statement of purpose. Like along with the resume, they have to mention that why they are inclined towards public health. What are their knowledge or not knowledge also, but what they know about public health and what they want to do in public health field. So they have to submit a good statement of purpose. It's not that it has to be very much technically, we cannot expect bachelor's level student to submit a very good technical proposal sort of thing, but yes, they can submit a statement of purpose saying why they actually need this scholarship, why they need this public health course, and why they are so much interested in this course.
One more thing, Isha, I wanted to know how many batches have passed out so far, and the placement.
Ma'am, so details for this, I think I have to ask sir because I am also a new joinee. Like
Okay.
it's been a 2-3 months for me also, so I don't know about the placements, but I'll just confirm it from sir.
Yeah. So, because especially for, like after they pass out, the placement is a very important thing. So yeah, it matters a lot, like as a sponsor for us as well as for the student. Right?
Correct,
Yeah.
ma'am.
Yeah. So anyone else has got any question?
Yeah, just an observation. So, Isha, you mentioned that, you have the mechanism that you ask for a statement of purpose. But very frankly, statement of purposes are written by somebody else, and they are the most fudged documents. Okay. So, I was just in the passing, I'll tell you that one of my friend's daughter got admitted into medical science in London. And he told me that his daughter had to undergo some 6 or 7 interviews. Okay. So you go through one department or one desk to another and to another, and it's so by the time of this interview sessions, you're so exhausted that you cannot hide your true intentions, or it takes a lot of effort to
Yeah.
uh, to fudge it, or to just to make it. So anyway, you all know best. I just thought of sharing this point.
Mhm. Yeah. And in a year, how many students, what is the intake?
Ma'am, intake is from 30 to 50.
Okay. So, ठीक है. Isha, thanks a lot. We'll
Thank you.
update. Thank you so much for coming and giving this presentation. And as I mentioned, if you can share the PPT, we'll also put it on our website.
Okay.
That is, the general, like if anybody is interested, they can enroll.
And any
Thank you, sir.
questions from Felicia or Felicia, Shom, Mohesh? We have been asking all the questions. So please
Yeah.
do ask.
Mohan sir
I
said
think
he doesn't have any question.
I think
Yeah.
it would be good, Isha, to publish, how many public health colleges are there in the country. What's
Hmm.
there? How many people are really
What is
being,
the demand? What is the
yeah,
supply?
Manipal,
What
what's
is
the
the
demand?
Manipal
What's
has
the
shortage?
got,
supply?
right?
Yeah,
Manipal has
in the
got a stream, I think, right?
Yes,
Yeah.
ma'am,
yeah,
but it is far more costlier.
yeah.
Okay.
Demand versus supply. I think demand versus
Yeah.
supply, the industry, what's the
Right.
within the country, what's the industry? If those statistics could be shared, I think that will also help
Mm.
us. And what's the
Sure.
uniqueness about your institute versus the rest, as you said, whether it's a caste or uh, I think that would also give us some additional input. Yeah.
Sure, sir. I'm making all the points and will add all these informations. So, and these are really valid points so that people can actually know about the stats of public health and the demand of public health.
Correct.
Yeah. Okay. Okay, Isha, thanks for your time. Much appreciated.
Thank you
Yeah.
very much, Isha.
Thank you.
Thank you, everyone. Thank you so much for this opportunity. Thank you.
Thank you.
Thank you very
Bye-bye.
much, ma'am.
Thank you.
Okay. Okay. So, yes, what is your opinion? Everyone's opinion?
The public health is really important. The
Yes.
question is, how do you attract the talent to that
Yes.
area? Is more difficult because of the priority of professions. If you see,
Mm.
the
No, not only
importance
that.
between.
I mean, as Subir was saying, even I wasn't very aware of it. Like what all opportunities the course will bring on. So this is really an eye opener. Otherwise, I actually, like when he was telling me about, I was just thinking, only science students may be required to pursue this. But yeah, there is maybe that awareness is still not there, about
See,
this.
nowadays, see, even medical profession, the medical profession, they are inviting people, non-science people too.
Mm. Oh,
It's
okay.
Yeah, so it's not any profession. You could jump
Mm.
from one to the other and truly eh, go through that process.
Mm.
It's not so difficult to change professions from one. Say you have done, say undergraduate, that is the 3 year or
Mm.
4 year college, in is like treated as a basics,
Mm.
like a high school.
Mm.
So
Mm.
if you see here, medical profession here, they invite people from any profession actually.
Mm. Mm.
Even
Mm.
literature also they will like invite people. They
Ah,
are really, yeah,
acha. Okay. Good. Good.
yeah,
Good.
because they
Yeah.
start the really specialization only when they get into that graduate studies.
Right. 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 So yeah. So here we are. So we will think about it, and let's
We have to think fast about it because the
yes.
time is running
Yeah.
short. We have a
Yeah.
deadline, right? We have a
Yeah. Yeah.
deadline.
Yeah.
Maybe you can
So.
skimp first 10 days of the classes, but max
Mm.
you can stretch it up only till 15th of September. Now the question is, maybe Gitanjali will have to ask. See, we spoke to this lady. We can possibly give women 50% of the money and get the student admitted. Okay, that's not the
Mm.
my bigger thinking is, where do we get the right student, and can we
Mm.
mobilize the student who will be willing to come and all that stuff.
Mm. No, let us see. Let us see. Even Banjul will come back to us, and then we'll call them
And the
on.
other one is, Gitanjali, you know some people in North Karnataka, right? You know that
Mm.
NGO, correct? And
Mm.
that's a very money stressed region, right?
Mm.
The economic conditions are not that great. They would also
Mm.
require, health professionals,
Mm.
very hardy people, hardworking people. So, I mean, if you can find any good candidate, the issue is, I think, about finding the right hardworking
Mm.
person. I'm not
Mm.
looking for brilliant people.
Yeah, really, yeah, it really
Mm.
doesn't
Sure,
matter.
sure.
Just check
I
with
will
that
give her
NGO
that.
that you
Yeah.
work with. If you find a
Mm.
preferable, I mean, I don't have any issue, but in case there is a lady who has exhibited
Mm.
certain traits of public concern, okay, empathy, public concern, hardworking, that's all should be the criteria I think
Mm.
we should look at.
Who has been in Rotary or any other community based
Rotary, to sir,
organization?
the Rotary is a very difficult thing because, very frankly, Ishwarji, in if you go beyond the cities in the hinterland,
Yeah,
it's a luxury to be a part of Rotary Club.
correct. Yeah, I know.
Mm.
It's a luxury.
Yeah.
So
Or
if in
Yeah.
volunteering,
the
isn't it? Somebody is
yeah,
volunteered,
volunteering
volunteering. Yeah, in
Yeah.
in any
social.
small mufassil towns, etc. If there is some student, deserving student, hardworking, community service, whom we can
Mm.
sponsor.
ठीक
Yeah.
है, ठीक है. So another thing is the ICGF. Mohan sir, I have paid